The World Health Organization has classified the EG5, a sublineage of the Omicron variant, as a variant of concern. It is also tracking 3 other new variants spreading across the world. The question is COVID-19 here to stay, and what does this mean for global health security? This is Sound Health on Lagos Television. I am Olasunbo Modupe. Welcome.
EG.5 is one of the sublineages of Omicron that is in circulation. In terms of its behavior, it has an increased growth rate, as we expect all of these sublineages that are emerging. We don't detect a change in severity of EG.5 compared to other sublineages of Omicron that have been in circulation since late 2021. What is important is that today, we will be classifying this as a variant of interest. It was a variant under monitoring. We need to ensure that sequencing continues. The virus is evolving. The virus is circulating in every country, and EG.5 is one of the latest variants of interest that we're classifying. This will continue. And this is what we have to prepare for. We need countries to continue sequencing and sharing with publicly available databases so that our technical advisory group for virus evolution can monitor, can assess, and can conduct these risk evaluations and publish them regularly.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Abi Abraham, and she is going to shed more light on the new variant being tracked by the World Health Organization. Good evening, Dr. Abraham, and thanks for joining us.
Thank you very much. It's a pleasure to be here once again, Mrs. Mutukwe. Thank you.
All right. And what do you know about the variant? Should we be worried?
Well, I think it's good to know actually what a variant is really. Because in the world of viruses, especially the ones that cause diseases like COVID-19, you might have heard about variants.
Yes.
This is really closely peddled around the place now. And variants are versions of the virus that have some changes in their genetic makeup. Usually viruses change a bit over time, like we have learned in the past few years that they always change. It is the natural way of the virus adapting. Now, when scientists are studying these viruses, they sometimes notice that some variants have different characteristics. They have different ways of operating. These could be things like how fast the virus spreads, how sick it makes people, or how well the current treatments or vaccines work against it. So when a variant shows these differences, it gets scientists' attention, not their worry, but their attention. So with regards to the variants now, there's some that are called variants of interest. And when you call a variant of interest, it means the scientists basically, they just want to learn more about it and how it affects the way we deal with the disease. In a nutshell, a variant of interest is a version of a virus that scientists are closely watching because it might have important changes that could impact how we manage and treat the diseases.
Okay, are symptoms of these variants different from the variants recorded or reported earlier? And do they pose a higher risk or threat like other variants?
Well, that's good really, because on the 26th of August, the NCDC released a very, very useful article with regards to 2 variants that are being closely monitored now. They are all descendants of the Omicron virus variant that we all learned about last year and the year before the last. So the ones that are being closely looked at now are the EG5 variant. The EG5 variant has actually been spotted in 51 countries, including China, United Kingdom, and lots of the bigger countries. Some countries report that 17% of the COVID infections right now are attributed to the EG5. Now, the EG5, according to the NCDC, has not been spotted in Nigeria yet, but it is a variant that is being closely looked at. Now, the one that is a little bit more, one of it has been seen in Nigeria, some in Africa, is the BA. So we have the BA4, we have the BA5, but the one that is really being looked at now is the BA86.
Okay.
This is all, very, very technical. But this BA2, it is BA2, but it is BA2 sub-variant BA2.86. It is not really in Nigeria yet, according to the NCDC, but it is being monitored very closely. Now, we have seen that the variants that we have at this moment, they possess a low risk at the global level and even in the country level. We still have the usual influenza type symptoms, which are things like cough, cold, a bit of fatigue, muscle aches, headache, sore throat. We don't have the typical COVID symptoms like loss of smell, loss of taste, and all that again. These variants are sort of like, in a sense, adapting within the environment and just causing flu-like symptoms. So according to the NCDC, there's nothing to worry about at this moment, and we should just take the usual precautions.
All right, Dr. Abraham, are we back to square one, and will COVID-19 ever go away? Because it keeps reoccurring.
Yes, I do not think we're back to square one. Under no circumstances are we back to square one. COVID was killing people so seriously in those days. Healthy people, people who had coexisting problems, people who had on dialysis, people who had chronic problems. It was just killing everyone and giving severe illness. We're not at that stage again. And I think there are two things that have helped us. The first thing that has helped us is, of course, the immunization, the vaccination drive, which was globally, pushed, and also people who have had COVID and have the antibodies at the moment. And so COVID is actually in the community at this moment. A lot of people, I think quite a few people have COVID and they don't even know. They think it's the flu. Some of them think it's malaria. I'm thinking of Lagos at this moment and the general Nigeria and Africa. Most people don't test again. We have very low testing levels, but it is just all over the place now. It's not massive or anything. It's just like the flu.
All right.
It is not going to, these variants do not appear to cause serious disease. Yes.
Okay, so will COVID-19 ever go away, and is it here to stay? Because from the look of things now, you said many people have flu, but they regard it as nothing serious. Will it ever go away? Are we going to be living with COVID for a long while?
I think the short answer to that is yes. COVID will, for at least in the foreseeable future, where it's going to be around. As to whether it will ever go away is a difficult question, but according to the epidemiologists, they cannot foresee. Those people who look at the characteristics of the disease deeply and look at disease patterns, it is not something that they can see in the future as of now going away. And so what we need to do is to have proper management and take the usual measures. It is going to be around for a while. Think about influenza, flu. It has been around for hundreds of years. It doesn't go. It just waxes and wanes. We have flu seasons and then we have non-flu seasons. The rainy season is a big season for flu season in Africa and in Nigeria. And then the dry season, we have other conditions. So the short answer is I doubt it's going to go away in the near future. So we've got to continue to take the usual measures.
Okay, what does this mean for people still holding on to some myths and misconceptions about COVID-19? Some unchecked facts, let me put it that way. And because you also pointed out earlier that people still don't do tests, the testing level is low. Does this have an impact on testing and all other precautionary measures put in place by the government?
I think the myths are always going to be there. Was there any particular myth you were thinking about?
That it is malaria, it is related to 5G, it is, stuff like that.
Yes. The myths are always going to be there. All diseases and infections have myths. It hasn't changed. Those who believe in the myths will continue to believe in it. COVID is not malaria. It has malaria-like symptoms, but it isn't. The vaccine does not affect fertility. It really has no impact on the myth because there was never I don't know, you have been following this very closely, and we all have. There was never any promise that COVID will disappear. There just wasn't. And so the myths, people just need to keep educating themselves on the myths. Nothing has changed with regards to COVID. It is still going to be a subclinical disease around the place. It is still going to affect people. To be frank, the main people that we're worried about are the people who have coexisting problems, chronic problems, people who are on things like dialysis machines, people who are on immunosuppressant drugs that suppress their immune system. They really do need to take a very, very close look at this and protect themselves very well. And with regards to the other members of the community, the advice is that they should please just if they have sneezes or coughs or colds, they should continue to wear masks. I will advise people to test as much as possible and try and make sure that they continue the usual advice like hand washing and making sure that they keep the environment clean. Things like that will help to prevent the faster spread of COVID and will make it a thing of the past more, quicker.
All right. The question everyone wants answer to is that are we looking at another round of booster dose vaccination? Some people have fully been vaccinated. Do we have to get another booster shot to hype our immune system?
Thank you for that. In a lot of countries, especially with regards to the Western countries, the China and countries like that, it has again been, there's no surprise to this. There's no surprise to what is happening. There has been a plan to have boosters in the fall season in most countries. And so the boosters are going to roll out in a lot of countries. I know, for instance, in the United Kingdom, where I also practice, the boosters are going to be rolled out very, very soon. United States, China, most of these countries, they're going to roll out boosters, and they're going to be yearly boosters. My advice is that if you can, please get a booster. And I know that the NCDC is making efforts. There are still clinics today that you can go to, the public clinics where you can have the COVID vaccine. And if you have not been vaccinated, it's always a good time to be vaccinated. My thought, and the thought of most epidemiologists and medical personnel, it is not going to go away. It is going to be with us for a little while, and so we're going to have to learn to deal with it. We're going to have to learn to conquer it in whatever way we can, and prevent it in whatever way we can.
All right, long COVID is still very much reported in some countries. Nigeria is not left out. How do patients experiencing long COVID, how do you recommend that they live with it?
Long COVID is a very, very mysterious condition, and it is still under serious research. Long COVID basically is if after 3 months, people still have COVID symptoms, or they have tested COVID, they are still tested COVID positive. It can be ranged from being a very distressing condition to being a very minor condition. Nobody is spared long COVID. Some people who just had asymptomatic COVID even develop long COVID. So there's nothing about it. Coping with long COVID is difficult because it could affect any symptom, any organ of the body. It could affect any part of the body. The commonest conditions are the fatigue. The commonest conditions are the fatigue, the cough, the headaches, the memory loss, the brain fog, the problems with the kidneys, a bit of heart palpitations and all that. How to cope with long COVID? It is going to be keeping healthy. So what is keeping healthy? Making sure you eat well, you eat right, you eat at the correct time of the day, you drink water, cut out fizzy drinks. Exercise is very important. If you know that you are having specific symptoms, like for instance palpitations, chest pain, incredible fatigue, go to your doctors, make sure you have blood tests, make sure you're on the correct vitamins, take your iron, just look after yourself, sleep well, eat well and rest well, and just keep a very cheerful countenance. Long COVID, we have seen that though it's a mysterious condition, though it could be debilitating, it is getting less and less in frequency and intensity. So that one is quite good news.
All right, we know that data is still evolving now, but what must be done to avert the pandemic in the future? Are there precautionary measures we want us to follow to avert pandemic, another round of pandemic?
Is it to avert another COVID pandemic?
Yes,
Or to avert
and
another,
to avert another
general
COVID-19 pandemic. COVID-19 pandemic.
Another COVID pandemic?
Yes.
We are going to have to continue to inform ourselves. The government agencies must continue to have working groups, technical working groups, which they have. I know the FCDC has a technical working group. I know the CDC in the United States has a technical working group who come together and study the disease, study the variants, and study how it is transmitted, study how it is making people feel sick, and study the treatment. I think we need to be looking at treatment right now, not just prevention. And I know there's a lot of study on treatment. We need to look at the antibodies and make sure that the antibodies, we are dealing with the antibodies and basically eliminating them. On the community level, we are going to have to find a situation where we have less and less of the COVID of the infection, so that it doesn't get to an epidemic or a pandemic level again. So the usual advice, like I've said before, the usual hand washing, wearing your mask if you have to, keeping distance if you feel you are infected with even flu, and just making sure you eat healthy and you drink healthy, you drink lots of fluids, take your vitamins and things like that. And with this combined force of prevention, I do feel that we will be able to prevent pandemics in future.
Dr. Abi Abraham, thank you so much for your time and expertise on the program. We really appreciate you.
Thank you very much, Mrs. Mutukwe. It was a pleasure being here.
All right, Sound Health continues with trending health report from around the world. Please stay tuned. It is still Sound Health on Lagos Television. Before we wrap up the program, we take a look at the International Overdose Awareness Day. Please stay tuned. This is still Sound Health on Lagos Television. You heard what Dr. Abraham said. You need to keep up with the precautionary measures, wash your hands often, wear your mask, and keep that distance 20 meters apart. That is what you need to avert the pandemic, another COVID-19 pandemic. I'm sure you do not want to experience that period or era again. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.